Prior to March this year, Waverley Care Milestone provided short-term admissions to people living with a BBV who needed more intensive support to maintain their health and well-being, avoid a hospital admission or to speed up a hospital discharge. However, when the COVID pandemic reached the UK, we closed the residential unit and drew up a plan to support our service users in different ways in the community. Very soon after this, we were approached by public health clinicians with a proposal to provide a step-down service for people who were vulnerable and homeless and who had been hospitalised with COVID. The recovery from COVID infection can take a long time, and to discharge somebody to a homeless situation who is still very debilitated by the virus, as well as dealing with all the other health inequalities they faced on a daily basis, wasn't an option. The following 3 weeks were very busy for the residential staff and others in the partnership. The roles and responsibilities had to be agreed. The funding for the enhanced staffing model had to be confirmed. The building was cleaned from top to bottom. We had to source our PPE and ensure that we would have regular deliveries of this throughout the model. By the time we opened on the 30th of April, it was apparent that though there were very few homeless people in hospital with COVID, there was an urgent need to free up hospital beds for COVID patients. With clinical input from our NHS partners and support around housing from the Cyrenian staff, the Milestone Intermediate Care Unit, or MICU for short, started to accept referrals from the hospital and from the community. Since starting, we've supported 32 people in the MICU. Most people have required additional nursing input for wound care, detox from drugs and alcohol, blood samples, medication reviews, and complications from liver cirrhosis. Several people have arrived with nothing except the clothes they were wearing. We've often had to access funds just to buy clothes and shoes, and actually even tobacco and cigarettes in an effort to keep people from leaving the unit. Most of the people we're currently supporting, they're not an easy group to engage with. Many have experienced a lifetime of trauma and abuse, financial hardship, loss and bereavement, prejudice and judgment, and a number of other events in their lives which impact on their ability or their willingness to trust others. They're not used to feeling safe, secure and cared for, and they've not had the opportunity to stop and breathe and accept help. Milestone has allowed them this chance, and witnessing the change in people from admission to discharge has been amazing. Everyone involved in setting up MICU has continued to work tirelessly to ensure its success. In particular, the Milestone staff team have worked for nearly 4 months straight, including doing extra shifts to cover the rota without taking annual leave. They were understandably anxious at the very beginning of the process, but they've given 100%. They could easily have turned around at the beginning and said they didn't want to do it, and we couldn't have blamed them, but they didn't, and they have been completely committed and motivated to making sure that the people we're looking after are looked after. In the meantime, throughout that time, we will be reviewing our services to ensure that we continue to support the vulnerable homeless patients and those living with a BBV, as there's clearly very similar needs within the two groups. And this will hopefully inform our future services after the 6 months.